Hi, I'm Dr. Ed Laskowski, and I'm co-director of sports medicine at Mayo Clinic in Rochester. I have a special interest in population health and wellness, and especially an interest in health and wellness in kids. There's a change in our country right now as far as the incidence of sedentary lifestyle in our kids, the incidence of obesity in our kids, and it's changing in a generation. It's changing very rapidly. The data now show that about 70% of our kids are not getting the activity they need. The incidence of childhood obesity has tripled in the last generation. There are many reasons for this. We have a fast food culture. We have technology that keeps us more sedentary, computers, video games, television. The incidence of television viewing correlates almost linearly with the incidence of obesity. But all these factors are contributing to make our kids less healthy. It's even such that the military is worrying that only about 25% of recruits are going to be eligible for military service. That's how deconditioned our kids are getting. So we need to make a difference in this problem. Data show that also 70 to 80% of kids who are obese as children will become obese adults and have all the sequelae of that. So it's important to make that difference initially in the kids so that they don't go on to have that pattern, don't go on to those significant side effects. We're seeing problems in kids that we usually see in adults and that we've never seen in kids before. We're seeing type 2 diabetes, adult onset diabetes in kids. We're seeing cardiovascular disease early on. Some calcifications in the coronary arteries appear as early as 5 years old in some studies. So we really are setting a template for a life that's full of the consequences and problems that these things can create, both obesity and sedentary lifestyle. So we need to get our kids moving. We need to get our kids active. Our current guidelines are 60 minutes a day of activity for our kids, moving all the major muscle groups. This can be in play. It doesn't have to be in sports. And there's a movement now called Project Play, and it's sponsored by many people, including the Aspen Institute, the Robert Wood Johnson Foundation, the American College of Sports Medicine, and the President's Council on Physical Fitness, Sports, and Nutrition. And this movement is all about getting kids back to free play, back to moving, and moving their bodies. Again, it doesn't have to be a specific sport. It can be, but it's just movement, getting out there and moving, getting out there and playing. And when we survey kids, we find that fun and being with friends, that's one of the main reasons kids want to play a sport anyway and do things. And there can be many activities that can accomplish this. But it is a serious problem in our country right now. It's a problem that we need to address in ways that are comprehensive. We need to have physicians involved. We need to have multiple specialties involved promoting this. We need to have education out there for the public on the severity of this problem. So in any way we can to influence this problem, we need to be proponents out there as physicians that we need to make a difference in this. We can make a difference early in our kids. We'll save them from a lot of problems later on in life.